September is dedicated to suicide prevention advocacy. So our podcast this month will be used to shed more light on this public health challenge. You may find the conversations that we have disturbing, challenging, or a trigger for you. So if you or anyone you know is struggling with thoughts of self-harm or suicide, please contact us on 0706 062 5054 and we will be of help to you. So hello and welcome to the Mind Clinic. I'm Chinyerigo, a clinical psychologist, and on this episode, we will be discussing suicide prevention advocacy. If you're a fan of the show, please follow us on Instagram, Twitter, on Neem Sanctuary, or you can reach us on WhatsApp 0706 062 5054. On this episode, we are going to be speaking with quite an amazing pair of mental health advocates. They will be shedding a lot of light on the conversation that we have. We've already started having a bit of it outside, so you'd have to beg me for a little bit more information. But either way, I have with me Jakpo Ukweke. Please correct me. Ukweku, thank you. I hate butchering people's names, so please call me out. And we also have Chime Asonye here with us. I'm going to give you a brief information about the speakers before we go into the conversation. So Jakpo is also known as the Raven. He has to explain why. He's an accomplished marketing, communication, and brand strategist with expertise in integrated marketing, business development, event curation, and advertisement. With over 12 years of industry experience with international and national organizations, he is the partner and director of marketing at Street Vibe Entertainment, and he holds a position at the Mental Health for Youth Initiative. Our second guest is Chime Asonye. He is a lawyer, policy advisor, and development practitioner. Currently, he serves as the founder of Nigerian Mental Health. They have over 30 plus mental health focused organizations within their network, working to advance policy and wellness programs and research. His organization was central to coordinating advocacy that helped pass Nigeria's first Mental Health Act in December of 2022. And that, like I said earlier, this Mental Health Act was the first mental health reform post-independence. And I think one of the best part of having these guests here, they are very active voices in a campaign on suicide prevention, a suicide not crime campaign. So that's why I'm more than excited to welcome Jakpo and Chime to this podcast. Please, a round of applause for my guests.
Glad to be here. Thank you for having
Welcome. So let's start. Why Raven? Jakpo, please explain. Why Raven?
I'm a marketing communication person, and Raven for me is, back in the day, it was a communication tool. Like when you want to send a message, you say send a Raven, right? And
awesome. So I'm going to start with you, the Raven. What is the motivation for the advocacy for? I know you advocate for mental health in general and suicide prevention. So what is the motivation for this advocacy?
For me, it's because I've been through some stuff personally as well. I've struggled with like issues of self-identity, imposter syndrome, just generally really focusing on how people perceive me, and getting to understand those emotions and realizing that a lot of people go through this and they don't even know that they're going through it.
Yeah.
And I feel like once you learn, like part of the mandate is to teach as well. So I'm really passionate about like helping spread that message. And also I just feel generally part of what the black race struggle with is that, right? Like we struggle with self-expression, we struggle with so many different things. So I generally am just passionate about like positive communication, helping promote wellness in general.
Yeah.
And just helping people see like when you're thinking about your well-being, don't just focus on your body, right? Like focus on your mind and also your spirit. But I wouldn't get too much into that.
Awesome. Thank you. And Chime, what's your driving force?
I like what Jakpo said, to be honest. I think what he said about self-identity, it's strange because I give a different answer every time I'm asked this question, and it grows more and more complicated. I think that Jakpo said it best. I mean, I think most people aren't called to mental health, they're dragged into it. So for me, it started personal in terms of just challenges I was facing, especially in Nigeria, that everybody faces. You know, there was a study that said, you know, almost 75% of individuals face some sort of acute anxiety. So it's not just me; most people are facing that issue. But I think that to go to not just struggle, but for me, just understanding myself. I really need, the mental health helps you ask those reflective questions about yourself, who you are, about your happiness, about your well-being, and I thought that was key.
Whenever we have the conversation about mental health, specifically suicide, there's a lot of misinformation out there, and the idea of, I guess, an advocacy is also to correct that narrative, to change that narrative, because once you talk about suicide, people think, oh my goodness, you're going to kill yourself. And for us in the mental health sector, it's not necessarily about, it's actually not about just killing yourself. There's a lot more behind that self-harm act. And I wanted to talk about the suicide crisis in Nigeria, the current issues. Do we have statistics? What are the numbers? Because when we talk about advocacy, we also have to bring to light what the numbers are saying for us, because some people are actually causing harm to themselves and they're hurting. But sometimes if you don't know what's going on, you may not be able to advocate and prevent it because you think, oh no, it's just one person, it's just two people. So is there information out there on the numbers, on how critical is this issue of suicide?
Okay. There is data, but it's limited. I'll approach this in a couple of different ways. The first thing is that when we think about suicide globally, it's a huge issue. We have over 700,000 people who die of suicide every year, and people don't understand how big of an international emergency that is. So that it's a huge form of structural violence. And when you take it to Nigeria, we have different challenges when it comes to suicide. We are the 7th largest in terms of rate of suicides on the continent. We're the 15th largest globally in terms of suicide cases. And suicide doesn't just happen in a vacuum, right?
Yeah.
There's an entire spectrum from suicidal ideation to the ultimate act.
Yeah.
Just to go to your point that when you think about suicide and the causes, it is not just somebody takes their life and that's it. There's a whole bunch of causes, a lot of challenges. So one of the huge causes, obviously, is depression. As a raw number, we have the highest cases of depression on the continent as a raw number. So there are challenges, but the truth is that one of the things that are going on right now is we're working on a suicide prevention strategy nationally.
Yeah.
And we're trying to figure out what the baseline data is, because we unfortunately, even though there's supposed to be some limited and National Bureau of Statistics findings, we look a lot to international statistics, right? The World Health Organization, the recent atlases to get our information, but that's a problem. We need that information locally, and the fact that the way that they get their information, they're not going to be able to talk to the local, chief or a medical practitioner or a community care worker to understand that this person took their life because of suicide. And because of the stigma around it, there's also going to be other challenges. So there's data and information. There's a high rate and prevalence of suicide nationally, but we need to do a lot more to get updated information that's sourced from locally indigenous resources.
Yeah. I wanted to ask you a little bit. You talked about the policy. Are you at liberty to share a little bit about it?
Sure, yeah.
Please go for it.
Okay. So right now is a historic time for mental health regulatory reforms in the country. We are engaged in an unprecedented reforms from the change of the National Mental Health Act being passed and the implementation roadmap that's being worked on, from the suicide prevention framework, from the the National Mental Health Policy update. The last time it's been updated, it was 10 years ago. Where less than 10 countries have a suicide prevention framework on the continent. So I think Nigeria makes us like number 9 that would have it. And the suicide prevention framework is supposed to focus on, it kind of has 3 pillars, I guess.
Yeah.
One pillar is this SWOT, So just understanding strengths, opportunities, and weaknesses going on in the sector. Next is the strategic direction, and there's different pillars from that, from things like service and crisis recovery, things like other enabling laws like decriminalizing attempted suicide, which is a challenging issue, and there's an implementation framework. I'll tell you where things are right now in terms of policy development is that there's been stakeholders that have been brought together from across discipline. One of the things that, and Jakpo was there too, when we were all working together to pass things like the Mental Health Act, and also to define what our priorities were. One of the things we said is that multi-stakeholder advocacy is very important.
Yeah.
So even in subsequent conversations, when we're talking about mental health advocacy, and we're talking about this suicide prevention framework, we need to make sure that it's not just mental health advocates, people with lived experience like Jakpo, people who are psychologists, people who are lay counselors, right, need to be part of the conversation. So we're there, and we're making sure that things like decriminalizing attempted suicide is part of it. So we've put together some of these initial pillars, and now I would say that a lot of the work is the implementation framework, which is actually where the work is.
Yeah.
You know, what is the baseline data? So how do we know that this thing has worked? We need to know the data, that we have a baseline from 2023 and it's reduced. And it's now from the suicide prevention framework is actually from 2023, 2030, which is also important to recognize. In earlier conversations, it was for 5 years because it was just thought we should have a mental health policy. But when we think we want to align to things like the SDGs that end in 2030, we want to align with other policies. So 7 years made sense for us.
Yeah.
So we're working on the monitoring evaluation framework. That's going okay.
Yeah.
But I think there's a lot of robust work that needs to be done there, and hopefully very soon is Suicide Awareness Month. I think that the idea was that they wanted to launch it this month. It's not going to be ready, so maybe next month for October World Mental Health Day, it'll finally be ready, and we'll be one of the limited countries that have one on the continent.
I think it's in as much as it was not ready when we want it out. I think the fact that we're already working on something, that's brilliant, because we have to start somewhere. And at the end of the day, it'd be good to have something, and whenever it's ready, it would be ready and on time. And I think the good quality, that's important. The implementation is important. And I like how the M&E is also, it's a very important tool to have, because you want to be able to measure that the policies that are being put out there and that are being implemented are actually working, like you've mentioned. I want to step down from from the governance point of view, from the policy point of view, and talk about the community, you and I want to focus a little bit more on social media. So I'm going to speak to Jakpo about that and say, how can social media and online communities, positively and negatively influence suicide prevention efforts? And what steps can we take to ensure a more positive impact?
So for me, like when you think about it, one of the greatest reasons apart from like depression is shame. Right, like a lot of people get to that point where they're too ashamed to express themselves, they're too ashamed to ask for help. So I feel like one of the things we need to address is the way we view shame as a society, right? The way you talk about the communities from the home front, right? We're having the conversation like before we got on, and I was telling you about how I feel like it's very important for us to think about how we have these conversations from when we're little, right? Like, what do you tell your kids? In African context, a lot of a sense of self is tied to accomplishments. It's tied to perception of how, and there's a lot of comparison, right? So social media can be a tool, and it can also be a weapon. I think right now we're going through a place where it's more weaponized in this capacity than it is being used as a tool. There's a lot of too much this versus this ideology, and like when you start to pitch people against themselves, it's like a lot of the outcome is not very outward. You don't see it. It happens internally. So just to come down to what you're talking about in terms of what can we do, I feel like we need to sensitize people more about how to use social media, kind of language. Also, media plays a big role, right? I look at what it's, and I think we need to move from the point of just focusing on what is trendy, right? What is trendy might not necessarily be what is right for us, right? I feel like we need to pay more attention to what is happening locally. And I feel there can be more emphasis on self-expression with the arts. I like to see it from a point of creating a more healthy environment for
Yeah.
your mind to flourish, not necessarily about forcing people in certain directions, just making them able to feel free. Now on social media is if you post something and people are looking for some form of validation, and like a comment can just ruin someone else's day,
Yeah.
right? So I feel like there's need for empathy, right? We need to be more mindful of the language, and it's not the kind of thing that you need policies for, right? I feel like we need to start from the home front to the schools, to
Yeah.
the kind of content that we create, right?
Yeah.
So one of the things that I like is this: we need more content like this, right? We need more conversations, because you think about it, is the content that people engage with, the contents they're exposed to.
Yeah.
Right? So we have to create more positive content. So part of what it is that I'm very passionate about is creating more positive communication, right? Even just more awareness in general, right? Something that like Chime and the Nigerian Mental Health, they've been doing is like teaching people more, right? A lot of all these myths and misunderstandings, how do we address it, right? In a way that, because of the way the world is, it has to be simpler, it has to be more friendly, it has to be more fun, right? I feel like we have to address, because of how sensitive it is, the communication for mental health related issues and suicide-based conversations have to be a bit more fun.
I think what kind of struck me is beyond what we're putting out there. What we're putting out there is a reflection of what has been put into us. So it also feels like there's this cycle of we're putting out information that could be incorrect because that's what was fed to us, and then we're also feeding other people information, and then just like this weird circle. So the onus is also on us to do something about it, to watch the language we use, to watch the content we put out there, because the way we have been, the information we've been given that has been wrong, if we do not control it, we pass on that same information. So we need advocates like you and I to also step up, and even if you want to go into that journey of advocating, it's aligning yourself with people who are already there, who can give you the correct and accurate information, because remember, it's on us.
Right.
We are the culture and the generation, and we are the society that we have created. So we have to do a lot of work around it. And it's good to hear that from a policy side, that there's something that is being done. It's something to be very proud of as a Nigerian, knowing that the conversations around mental health used to be non-existent. And there's a lot that we can do. If you're in the media space, if you're even in your individual capacity, there needs to be a lot of work that has been done. As advocates, I'd like to ask the both of you, and whoever would go first, that's fine. Are there any success stories that you have heard about what has been done? Maybe what is working that you think we can adopt and use in our communities, as individuals, in our families, and even in the society?
Okay. For suicide prevention?
Yes, for suicide prevention.
Yeah, I mean, real quick, I want to just comment on the media question. I 100% agree. Media can be very negative. So you have other things like cyberbullying. You have something called the contagion effect, and that is when individuals are exposed to kind of sensationalized forms of suicide and glamorize it, and they can get suicidal ideation. So that's a really big impact. So I want to emphasize that proper media coverage is important, and so important. And even the way we talk about mental health. So we talk about mental health a lot of ways. Like, the popular conception is that somebody's inflicted by God, or they have some sort of disease, chemical imbalance, and they have a disease that needs to be cured. The issue with those two framings is that they don't incorporate psychosocial dimensions of mental health, right? And in the media, it covers it like that too. So if you cover it just in terms of drugs, or if you cover it just in terms of an illness, right, you're not going to get to other issues that impact mental health, whether it's poverty, right, whether it's family and community dynamics, where it's however traditional cultural beliefs, you're not going to engage in that way. So I would implore the media we need to cover it in a lot more refined ways. We need to think about the social dimensions. We need to think about the economic dimensions of these things, because when we think of, Jakpo said it's mind, body, and soul, right? There's a society, there's your mind and body, but right now we're just thinking about it in a black and white form from God, and we're not really getting to where we need to. But just real quick in terms of interventions, there's a lot of good ones. We have organizations within our network like Sunshine Series and Serpent that have crisis hotlines, which is very key. coming back to reporting, if you look at a lot, unfortunately, in Nigeria, when people are talking about suicide, they don't have reporting that mentions resources, right? But then again, we don't have a national crisis hotline. But if you look at international reporting, they'll mention resources that are right there in case somebody is seeing that they know where to turn to for help.
Yeah.
So that's the key thing. There's other campaigns that have worked. In Australia, there's one called Are You Okay? Which is just asking individuals to check on their friend or community member. The Nigerian kind of affiliate version I really liked was one done by MI. MI had this campaign for men where we would ask, "Guy, are you all right?" And just to check in on folks. And there's other good examples too. There's something called the zero suicide campaign in America that adopts a systematic wide approach to help with trainings, to help with cultural shift, and understanding that the factors for issues need to be institutional led and cross sectional. So there's a lot of good models to adopt. It's just making sure that we adopt them locally.
Context, make them very context specific.
Exactly.
And for you, Jakpo?
I've seen a lot of programs in like secondary schools.
Yes.
I feel like that is one direction, especially in terms of in relation to drug usage as well, just sensitizing them to the harms of it. There's a friend of mine that has a foundation, David Folarimi, very active on that. And I've seen like a couple of programs where like the likes of NDLE have partnered with, because there's a very strong correlation. And it's also something I found out about like the people in the creative space and how they approach drugs. There's a bit of that misconception that like for you to be truly creative, you have to, even if it's not your thing. So you have a lot of people that are somewhat pressured into that. So I've heard about campaigns that target more people in the creative space because sometimes they're ignored and they're not really seen as professionals. So part of what it is I see is happening now is more conversation in that space because it's almost like glamorized too.
Yeah.
And even the kind of music. So there are campaigns that focus on like the content of music, the kind of music that you expose your kids to, because those play a great role. But the truth about it is like there's opportunities for a lot more to be done. I'm a strong believer of like it's not just about having all these formal programs and plans. Like Chime also mentioned about like the kind of conversations we have within ourselves. I feel like part of the kind of campaigns we can start to run is like making people know that it's okay to just have these conversations, right? Like it's okay to speak.
Okay.
Yeah, it's okay to be okay.
Yeah.
And especially for men, right? It's almost like you have to be macho all the time. You have to have your shit together. Excuse my language. But it's important to let them know that there's more to being a man than just providing, and just like you have to be able to help yourself, so to speak.
Very important.
Before you can help people. And also like with women as well, it's like in terms of like campaigns around objectification and just like putting them into domestic brackets as well. I feel like there are a lot of campaigns where I see like women are started to show that like it's possible for them. I see like NILD's National Institute for Legislative and Democratic Studies. They have programs for women, educating them. They just had a conference recently where they brought like parliament members from Kenya, from other parts of the country, like who are women, showing these girls that like you don't have to subscribe to domestication in some capacity. Like it's okay to dream. We had women that like came out and said like I was a full-time mommy and like I took care of my kids and I was able to get to the apex of my professional career, because sometimes the communication and the narrative is a trade-off, right? It's like you either be a house, right, or but then, and part of what the problem is like there's not a lot of stories that are being told about women that are doing both. They exist, and like some of them are our mothers, some of them are our aunties, but then what you find is the narrative that is being pushed more is more about like, and also I feel like there's a lot of campaigns that can be done in terms of just sensitizing women in general, and because the ripple effect is like if these men have flaws, it affects how they treat their women and vice versa. So there's a lot of conversation around like gender-based identity and equality that I've seen.
Awesome. I think hearing this is I get hopeful. I get really hopeful, but then I also worry about everybody doing their things. And, it kind of also brings me back to Nigerian mental health and, being able to bring everyone having the same conversation together so that we have a little bit more of an amplified voice. And I want you guys to touch on your suicide not crime campaign. I really want you to talk about it. And, there really is need for you to bring in people who are also focused on suicide prevention. Because like you mentioned, when we were also like doing the research and going back, we have done a suicide prevention work like 2-3 years ago, and we did bring organizations together. But then and now, the difference isn't even much in the resources available. And at the end of the day, you want to make sure that you have professional resources. So you're looking at the quality of what is out there, because you don't want to be putting out information that will cause more harm. So it's also for bringing people who have a professional and quality service to give the people that would benefit from the program. So please touch on your Suicide Not Crime campaign while we wrap up this conversation.
Yeah, so Suicide Not Crime campaign is a campaign that Nigerian Mental Health and Partners came together to do because we think that we can't stop on the momentum of the Mental Health Act being passed. The Mental Health Act, the regulatory framework was colonial, and the same colonialism that resulted in the Lunacy Act that we had before is the same reason we have attempted suicide. If you look at the 20 or so countries that have attempted suicide now, every single one of them can be traced back to a Commonwealth country or colonial or a product of British colonialism. So we have colonial policy that's not our own, that criminalizes psychological vulnerability. What people need is not a judicial system, they need a public health solution.
Yeah.
And so we're trying to decriminalize attempted suicide. People can get involved. So we have 30 plus organizations that have came together to push this. We have a petition now on change.org. They can come on Nigerian Mental Health's website and click on the tab that says Suicide Not Crime. They'll be able to sign the petition. They'll also be able to read a policy memo that details this issue extensively as well. And we're going to be launching formally as an honor of Suicide Prevention Month, Awareness Month, later in the year. We're going to be launching a formal policy launch of the brief that shares more information and includes it. So it's important that we decriminalize attempted suicide and stop this colonial legislation.
Awesome. Thank you. What are your closing thoughts to our listeners regarding suicide prevention?
So I feel like it's something that we should really be mindful of and pay attention to. Like Chime said, it's like a demon like in the shadows, right? Because like when it happens, because of the stigma, like a lot of families don't even report it, right? It's something that they want to hide. There's a lot of, back in the days, like you couldn't bury people in certain places if they killed themselves and whatnot. So I feel like part of what it is that is important is more empathy, and we should be more open to having conversations with our people. Because sometimes you see, when we see a suicide note and then you read some of the comments and people that knew them, they would say, oh, no wonder he was acting this way. Like, oh, he said this to me. I feel like it's also important for us to be more mindful of family and friends and like look out for social cues. Yeah. Like when you see someone just go into their shell all of a sudden, like it's you might think you're being nosy, but then it's also important to just find ways that you can have conversations with them. Yeah, definitely. Conversations around suicide can be very scary for many of us. And like Jakpo rightly mentioned, mental health, we take mental health like some I don't want to use the word strange. It's like this serious thing that once you have it, your life is over. And we forget that every one of us at some point in our life, we've struggled with our mental health. And because we've had the support, because we've had resources available to us, we found a way to kind of bounce back. And this message on suicide prevention is for everybody listening. It can be tough, it can be hard, but when you're going through those dark times, there are resources available for you. It's very important for you to reach out. And I'm going to just echo again what Chime said about we as individuals too need to reach out to our loved ones. We need to reach out to people. So the reaching out is both ways. When you're in distress, reach out. When you see someone in distress, reach out. I'm going to leave that as my pattern words with you.
A big thank you to our guest speakers. Thank you so much for bringing your wealth of knowledge and experience to this conversation. And to you, our listeners, thank you for listening, and remember to stay mentally healthy.